Cardiac rehabilitation is one of the most powerful tools available to help heart patients recover strength, rebuild confidence, and significantly reduce the risk of future heart problems. Yet despite its proven benefits, many patients unknowingly make one critical mistake that slows healing, increases complications, and sometimes even leads to avoidable setbacks. And that mistake is either doing too little out of fear or doing too much too quickly out of overconfidence, because both extremes prevent the heart from recovering in a safe, steady, and scientifically progressive manner. And understanding this balance between caution and gradual effort is the key to successful rehabilitation. After heart surgery, angioplasty, bypass, valve replacement, or even a heart attack, the heart muscle is healing, the body is adjusting to medications, circulation is stabilizing, and the mind is coping with emotional stress. So the recovery process must be structured, consistent, and supervised, rather than rushed or avoided. Yet many patients fall into the trap of thinking rest alone will heal them, leading to prolonged bed rest, inactivity, muscle loss, stiffness, poor lung expansion, blood clots, and decreased stamina, which ironically makes them feel weaker and more afraid to move, creating a vicious cycle where inactivity worsens fatigue and fatigue discourages activity. On the other hand, some patients feel better after a few weeks and suddenly attempt long walks, heavy lifting, climbing multiple stairs, or returning to intense work too soon, placing sudden strain on a heart that is still rebuilding its strength, increasing risk of chest pain, abnormal rhythms, breathlessness, or even new cardiac events. And this all or nothing mindset is the most common rehabilitation mistake. Cardiac rehab is not about extremes, it is about gradual progression, small daily improvements, and listening to the body carefully. In the early days after discharge, the goal is simple: movement, sitting upright, gentle walking inside the home, breathing exercises, improving circulation, not athletic performance, and these small movements prevent complications like pneumonia and clots while gently stimulating the heart muscle. As days progress, walking time increases slowly from 5 minutes to 10, then 15, building endurance step by step, because the heart adapts safely to progressive stress, not sudden overload. Many patients mistakenly compare themselves to others or to their pre-surgery fitness levels and feel frustrated. But recovery is individual and influenced by age, prior fitness, diabetes, blood pressure, and surgical complexity. So patience becomes a crucial medicine. Another frequent mistake is skipping supervised rehab sessions or follow-ups because they feel fine. Yet structured rehab programs provide monitoring of heart rate, blood pressure, oxygen levels, and rhythm changes that the patient cannot detect alone, and this monitoring ensures exercise intensity stays in the safe zone while maximizing benefit. Medications also play a major role in safe rehabilitation, and skipping doses of blood thinners, beta blockers, or cholesterol medicines can silently increase risk during exercise, so adherence is essential. Hydration and nutrition are often overlooked, but dehydration thickens the blood and strains circulation while poor diet delays tissue repair. So balanced meals with protein, vegetables, and controlled salt support healing. Emotional health is equally important because anxiety after heart events is common and can cause patients to either avoid activity or overexert themselves to prove they are normal, when in reality recovery is not about proving strength but building it slowly. Learning to recognize warning signs during rehab is critical. Chest pressure, dizziness, unusual breathlessness, palpitations, sweating, or extreme fatigue are signals to stop immediately rather than push through. Yet many ignore these signs thinking discomfort equals progress, which can be dangerous. Proper warm-ups and cool-downs are another often missed component, as suddenly starting or stopping activity stresses the heart, whereas gradual transitions allow safe adaptation. Posture, breathing technique, and light resistance training matter too, because strengthening muscles reduces workload on the heart during daily tasks. Sleep, often neglected, is when tissue repair and hormonal balance occur. So poor sleep delays recovery. Social support from family encourages consistency and prevents isolation that leads to inactivity. Tracking progress with simple logs of walking time or steps helps patients see improvements and stay motivated. Avoiding smoking and alcohol remains essential because they counteract all rehab efforts. Many also forget that cardiac rehab is not temporary but the beginning of lifelong heart-healthy habits, meaning exercise, diet, medication, stress control, and regular checkups must continue even after the formal program ends. Another misunderstanding is believing that feeling tired means the heart is failing, when mild tiredness is normal during rebuilding and should be managed with pacing rather than avoidance. Conversely, believing that absence of pain means unlimited activity can lead to overtraining. Learning to work within a safe heart rate range is one of the smartest strategies for protection. Gradually incorporating light household tasks builds functional strength. Celebrating small improvements builds confidence, and understanding that recovery is measured in weeks and months rather than days prevents disappointment. By avoiding the central mistake of either excessive rest or excessive strain and instead choosing steady, supervised, progressive activity, patients allow their heart muscle to grow stronger, circulation to improve, stamina to return, and risks to decrease dramatically. Cardiac rehab is essentially retraining the heart for life, not racing it, and those who follow a balanced plan consistently experience better outcomes, fewer hospital visits, and greater independence. The message is simple yet powerful. Don't rush, don't avoid, progress slowly. Stay consistent, listen to your body, follow medical guidance, and treat each day's small effort as an investment in long-term heart health, because steady steps forward are what truly rebuild a stronger, safer, and healthier heart for the future.